You'll need a medicine ball, towel roll, and 2 balance pads, or you can use a yoga block. Line your side with the towel roll between your lower lateral rib cage and top lateral pelvis. Your neck should be positioned so that it is slightly side bent up towards the ceiling. Your top leg should be positioned directly on top of the medicine ball. When looking from below, your ankle, hip, and shoulder should form a straight vertical line. Roll your pelvis over the bottom hip so that the hips are stacked, and make sure to check back in periodically to ensure that the top hip doesn't roll back. Step 1. Reach your top leg down over the medicine ball without lifting off. You should feel your top hip moving away from your top shoulder. You should feel your glute turn on while in this position. At the same time, you should feel your lateral ab wall lift up off the towel roll as the bottom hip moves closer to the bottom shoulder. So before the foot lifts off the ball, we should have sense of both the top glute and bottom abs. For step 2, push the outside of the bottom side foot down into the floor and rotate the knee up into the air. You should feel your bottom side groin, aka adductor, and lateral glute, or the anterior glute medius, turn on. If you can't hold on to the top glute and bottom abs from step 1 while performing step 2, you should stick with step 1 and practice that position for a while. Step 3 involves holding on to steps 1 and 2 and lifting the top leg up off the ball. This will only increase the demand on the top side glute. One final point, make sure to avoid pressing your head down into the balance pads. It's very common to try and find extra stability via your neck when you're trying to hold position and focus on recruiting very specific muscles. Keep your neck relaxed and perform controlled breathing throughout the movement.